Hey y'all, this is Dr. Pete or Dr. Pete, and I am a board certified pediatrician for almost 2 decades now. I've been a pediatrician for 23 years, and I just want to talk about a few things. Um, I never imagined that during my career things would get so bad with vaccines. And by so bad, I mean that millions of Americans are choosing not to vaccinate their children for two reasons. They have been misinformed and they believe it, or they're hesitant because of the misinformation that's out there and they're not sure who to trust. Um, the tools of anti vaccine rhetoric are based in fear. Fear is easy to do. All you have to do is say something that sounds correct, and people believe it. And then I have to do 6 times the work to fix it. Someone said what somebody can say in minutes, you have to spend 3 to 6 hours lecturing. There's a internet phrase called Brandolini's Law, and it's basically saying how the amount of work that I will have to do to debunk misinformation is massive compared to just lying and saying the thing that's wrong. So it's pretty frustrating. One of the things I'd like to teach clinicians to understand how to combat misinformation is to learn logical fallacies and to learn biases. So the number one logical fallacy that I deal with every single day is probably tu quoque, or whataboutism. So people will say things like, well, don't you get kickbacks for giving vaccines? So it's an attempt to make me look like a hypocrite because I get paid to give vaccines. First of all, I get paid to do vaccines, but I pay for the vaccine. So anything I'm paid, I'm buying. So, or I'm paying an employee to administer the vaccine. So every vaccine costs me money. So if I'm getting paid back for the cost, that's a break even kind of thing. I don't make a profit very often. So of course we get paid, but it's a false statement. But because it sounds conspiratorial, like, well, you guys. So that's a logical fallacy. Another logical fallacy that the anti-vax people like to use is ad hominem attack. They will attack your character, how you appear. I'm old. I'm a man. And I'm not exactly thin. I've always been a big fella. I'm almost 49 years old. I've been a big fella most of my life. And I've worked on it most of my life. And I'm going to continue to work on it. And I'm as healthy as I've ever been because I'm putting my health first. And I appreciate the trolls attacking my appearance because it forced me to get serious about my health. So thank you, trolls. Another logical fallacy I deal with a lot is false equivalence. So that's when people try to compare two things that really don't have anything to do with each other, but it sounds good to them. An example of false equivalence, the better example is like in politics, when you say, well, both sides are bad. I'm like, no, in the current political arena in the United States, there's really only one party that's bad. We know who that is. Another logical fallacy I deal with on the regular, would be the nirvana fallacy. So that's when you have a discussion about universal health care, and they say, or that vaccines aren't perfect. I'm like, well, no vaccine is 100% effective or sterilizing. That just doesn't exist. Even antibiotics aren't perfect. They come with lots of side effects and they're not always effective, but the expectation that something has to be perfect in order to be effective is the nirvana fallacy. Sorry. Universal healthcare doesn't have to be perfect. It's never going to be perfect. We're always going to be working on it. Science isn't perfect. We're always working on it. That's the whole point of science. So nirvana fallacy. Now let's get into the biases. Biases are things like selection bias. So that's when somebody chooses to pick a perfectly healthy person that's never been vaccinated and they're perfectly fine. Then there's the flip side to that is when you say, well, my child has never been vaccinated and they're perfectly healthy. That's survivorship bias too, because they're saying, well, my kid's fine for now, but if they were exposed to the illness that they're not protected against, they will get sick. So being mindful of these logical fallacies and these biases, you can learn how to navigate most comment sections pretty quickly. Now, these people aren't going to shut down. They're going to keep going. So then you need to learn the disingenuous questioning person, or the sea lion, or sea lioning. So this is the last thing I'll talk about. So sea lioning is when somebody keeps asking disingenuous questions or keeps a conversation going or keeps making comments, and they're basically nonsensical. They're basically the same whataboutism, the same tu quoque, the same false equivalence, the same nirvana fallacy, one bias and one logical fallacy after another, over and over, repeatedly. Because there's one thing that the anti-vaccine science doesn't have, and that's evidence. So they never present you with evidence, and when they do, they cherry pick it. Again, there's another one, confirmation bias. That is the root of all anti-vaccine rhetoric, is cherry picking what tells you what you think is already the case. When you go down that rabbit hole of anti-vaccine, the only thing they teach you is to look for the things that tell you what you want to hear and you want to see. That's confirmation bias. That's the worst of all. That is the worst of all. When you look for what you expect to find, you're going to find what they told you to. But it's going to keep telling you the same thing over and over. It's not going to tell you the truth. The truth is, vaccines save lives. Vaccines are very safe. Vaccines are very effective. And that children are going to be harmed by the lower and lower rates of vaccination. So, thank you for coming to my talk. I appreciate your time.